back on Live at 9. Now, here's Kanji.
The National Partnership for Women and Families reports that Black women are more likely than any other racial groups to express interest in having their baby at a birth center or at home instead of a hospital. And this morning, we are learning about this trend from Choices Center for Reproductive Health Midwifery Program Director, Dr. Alexis Dunn. Thank you so much for coming in, Dr. Dunn.
Thank you.
Okay, so what is midwifery? I was like, midwifery.
Yes, so midwives, we've been on the scene for thousands of years, and there are many different types, but at the Choices Center for Reproductive Health, we are nurse midwives. So we're trained in both nursing and midwifery. And
it's midwifery, thank you.
Yes, that's okay.
Because I was thinking wifey.
I'll give you a pass.
No, I'm glad you're teaching me.
Yes, and so we're trained as nurses and midwives, and so we've completed at least master's or doctoral degrees. So we're kind of like nurse practitioners, but we specialize in nurse midwifery.
Okay, so what is a birth center and how does midwifery care differ than the hospital setting?
Okay, so a birth center is a freestanding facility where you're able to receive your prenatal care, but you're also able to have your baby within that space. And so the difference between that and the hospital is that we center you and your family as the primary focus. So you're able to bring your family members, you can bring your children with you. And we're able to provide a holistic, comprehensive care. So we spend a lot of time talking about nutrition. We talk a lot about stress. We talk about your mental health. We spend a lot longer time in your visits, right? So when you come to us, we spend at least an hour with you on your first visit, and all of your other appointments are at least 30 minutes. We come see you at your house. We follow up with you, 7 days, 1 week, 2 weeks, 6 weeks postpartum, and we really spend that time with you and your family.
And I don't know, all I can think about is costs and insurance, and what if you're uninsured?
We accept, at Choices, we accept all insurance. As a matter of fact, 60% of our clients are Medicaid. And so, our belief is that we're there to take care of everybody. You shouldn't have to not receive nice care in a beautiful facility because you can't afford it. So we have patient assistance programs for people who, let's say, if you're not insured, where we can help you with that. But we accept all major insurance. So if you have private insurance, Medicaid, we accept that as well.
Okay, now we're seeing these statistics that African American women are showing a great interest in midwifery. I did not want to say that. Midwifery-led care. Explain to me why you think this is happening and what you're seeing in that field.
Okay, so midwifery is about physiologic birth, right? So just like you breathe and you do things naturally, we believe that birth is a natural part of your physiology. So as midwives, we lean into that. So we're trained to step in if there are complications that come up. We are trained to follow clinical practice guidelines and things of that nature. But for the most part, we are there watching your body, encouraging you to eat the foods you need to eat, to make sure you exercise, to make sure that you're talking to your family about your challenges throughout your pregnancy, healing your traumas, right? So that we prepare you for the challenge of birth, and then we walk with you through it. So the difference in the model is that it leans into normal physiologic birth. Birth is not a disease or an illness that needs to be intervened in, right? We are there to guard and protect you as you move through that process. And then if things come up, then we are able to intervene with medical intervention if necessary.
I think that pregnancy is taking on a whole new thing, even with celebrities. Just kind of like when they're pregnant, they're like having these outfits where they're like, birth is just really it's a beautiful thing. Talk to me about there have been a lot of rulings, and it's kind of unclear how things are going to be covered, or how are you guys dealing with the situation?
Yeah, it's hard. Being a midwife, you're naturally an advocate. So if you think about our history, midwives are always in the community with the people, and that is the same approach we use. So we just stay grounded in our communities. We are very active on the Hill. We're looking at the legislation. A lot of us are working at the national level. Myself and others are national officers. And so we're working on a national level to think about how we can continue to fight. So we're standing in the gap, and in the meantime, we're just protecting the most vulnerable. We're going to continue to show up. I'm not going to back away from doing what I was called to do because a law changes. I'm here to protect people, and that's what we as midwives are going to do. Okay,
we have about a minute left. We have pulled up the birthing center. Look at this. That's beautiful. Tell me what that is, and then we're going to do a simple technique, like one calming technique that midwives use. But tell me about the birthing room.
Okay, so look at that suite. This is right here off Poplar, the big pretty green building. When you walk in, you have a full bed to yourself, a queen size bed. You have a birthing tub in the corner. So if you're interested in water birth, and we didn't talk about that, but we do water birth at the center. Yes. Yes, water birth.
Okay, and now, okay, you have an event coming up, and then
Yes.
we're going to do that little, tell me about mimosas and,
Yes, midwifery and mimosas. So the event is designed to uplift the women we deliver. So it is for the midwives and for the families. And so the goal is to raise money so that Choices is able to continue to provide that comprehensive reproductive care that all people deserve. So all proceeds from the event will go towards the birth center to ensure that Memphians and people in the Mid-South have access to this care.
Okay, doctor, if we could just do that one calming technique that not just pregnant people, but I think everybody could benefit from.
You know what? You always hear about Lamaze and breathing. Breathing is the essence of life, right? And so one of the things, of the few things we tell people to do is always to center yourself in your experience. You know, take some time to take slow, deep breaths. You can go in your nose, out your mouth, and make sure you lean into being mindful and being present in the situation. So that can apply to any of us, right? So when you're having a baby, it is a natural process. It's like an ocean coming in, a wave coming in and out. So a deep breath in and out. And we do that with each contraction so that you're centered and you're grounded in your experience.
Okay, be grounded. All right. Thank you so much for showing us just this new trend and the new spaces, and have fun with the mimosas and whatnot.
We will. Thank you so much.
All right. Dr. Dunn Moore. All right, we'll be right back, but we're going to first do a quick check-in here, I believe. Yes, who is voting for the Hawks? Sorry, I am definitely slanted here. Apologies. We're checking in on this morning's game poll. You still have a chance to be heard. We're going to put up a QR code. You see it right there. Looks like it's 75% to 25%. The Grizzlies are in the lead as far as taking home the win tonight. Again, if you haven't voted yet, there's still time. Scan that QR code. Get your prediction in. Will the Grizzlies win over the Hawks tonight before the final? We'll show you the final results before the show is over, and we're going to reveal the poll winner. So we'll be right back.